This is my song about with what you put in, you get out. You're for welfare if you.
Everything is possible. It could be your mama, your papa, brother and sister. Let's stand together to fight this deadly disease now. Walk on the wall we live in. Hold on uncertainty. No security. Everything is possible. It could be your mother, your father, even your sister.
Good morning, everyone. Good morning to Radio Land. Good morning to our distinguished viewers. Thank you so much for joining us this morning, wherever you are. Today we are discussing substance abuse or substance use and abuse. Substance abuse is fast becoming a major problem in this part of the world. It is something that is destroying our youth, our families, and community out there. Now, this has been a very good picture of our country and in community cooperation in fighting it. What substances are used out there? And what are the reasons beyond it? What are the effects of substance abuse on our physical, mental, and social well-being? What can we do to prevent this problem from spreading across the country? And how can those that feel trapped in a spiral of abuse be assisted to get up? Stay connected because this is the focus of our show today. We have our guest panelists in studio to discuss this all-important topic. We will tell you all about substance abuse and how to overcome or get rid of substance abuse. Our panelist comprises of a psychiatric, of nursing lecturer at the Smart and Greater Vision School of Health Sciences, St. Paul District Mental Health Supervisor. Next to him is a registered nurse and a recent graduate of child and adolescent mental health clinician. To our viewers, we invite you to please be part of this show by simply asking our guest panelists questions, or you can simply call and share your view with us. The numbers to call is 0770-107-107, 0886-107-107. If you are outside Liberia and you want to be part of this all-important discussion, you can also call our WhatsApp number +231 880-571-223. That's our WhatsApp number, so you can also call and be part of the program. So sit back, relax, and learn from this educated show coming to you just after a short break. I am Mama Elume. This is Health Talk.
Liberia. Mama Liberia. That's all right.
This is my song about with what you put in, you get out. You're for welfare if you.
So welcome back to today's edition of Health Talk. On today's edition, we are discussing substance use and abuse. The Mama Element Health Talk platform is a 1-hour program that discusses a wide range of health-related issues. We bring you face-to-face with health professionals and provide you with causes, signs, and symptoms, complications, and preventions of diseases and illnesses affecting us in our respective communities. On today's edition of Health Talk, we have with us our dynamic studio guest, a psychiatric instructor from the Greater Vision and Smart Institute, right, of Medical and Technology. He's also the supervisor for mental health at the Simple District. He's no one else but Mr. Dason Kofi. Mr. Dason Kofi, welcome to Health Talk.
Thank you very much, Mama, for the time you have given me to be in the studio, and thanks to the Hot FM family for giving this platform in the elaborate courage in order for us to help our people in Liberia and help our brother and sister, especially when it comes to substance use disorder.
Okay, thank you so much. And next to him is no one else but a registered nurse, and he also being part of, I can say, almost half of this mental health discussion. He is a recent graduate. He graduated a child and mental health clinician, right? He is no one else but Nelson Freeman. Nelson Freeman, welcome to Health Talk.
Thank you. Welcome everybody. And thank you the platform. Thank you to our supporters. Thank you to our viewers and listeners. Please stay tuned as we discuss substance use disorder today.
Thank you so much. Thank you, gentlemen. Thank you guys for being part of this discussion today and for at least accepting our invitation to be part of us today so that we all can discuss this important subject. Now let's start the ball rolling. Coronavirus have been affecting people in many ways, right? Mr. Kofi, coronavirus have been affecting people in many ways. It been just the 12 years, and one of the things that we are seeing is raise in addiction. So just tell us what's happening with the people turning to substance abuse.
Thank you very much, especially coronavirus, especially make plenty people to sit down home and all of our cluster, and something to speak out from observation. People use substance, especially alcohol. They say that's why I can kick it away. And you should, in Maryland we say naslon, and you should take your gin. I think you can take it away and other things. But gradually you'll be entering into it, and that's why we are seeing our people in the midst of this pandemic. People are abusing substance. So when we talk about substance use, we are talking about, and it will lead to a disorder. It's a gradual process. So we say substance use is the same as or drugs disorder. It's a process in which you continue to take these drugs, then it affects your impairment or the way you think, the way you act, or the way you behave. Especially at work, you're not behaving normal. At school, you are not performing, you are declining, and even in the community, you are causing a whole lot of problems. So, in the midst of this COVID, these are things that, especially when you go to some entertainment area, these people, when they go, as soon as they see liquor, I don't know what all the eyes are really coming from, but these are things that are really disturbing us, and we need to talk about it.
So my focus here was we are looking at the addiction aspect, right? It is the result of anxiety, isolation, or people being quarantined. Is that the result of people being addicted to substance?
Yeah, if we look at addiction in a sense, because in COVID brought a whole lot of things, depression, anxiety, and in substance use, if someone is depressed, especially they are frustrated and other things, they take in things that will make their worry to put away. So within that midst, people, yes, are taking in substance in order for them to take it and get relaxed and get people to see who saying they are quarantine or people are staying home, people are not going all around. They try to take something, for them to be at ease. So they misuse substance, in that direction.
Okay, thank you so much, Mr. Freeman. Let's start with you again, Mr. Freeman. We're talking about substance use and abuse. What kind of substance out there that is the major problem to our country?
Mamawa, there are so many different kinds of substances that are abused out there. Like drugs that are prescribed can be abused. Drugs that are not prescribed, which we call over-counter drugs. It may fall in the legal drugs or illegal drugs. All of them are abused. And even some regular foods we eat, they are also abused. Okay, if we're looking at drugs that are prescribed and being abused, can be like, usually happens because of the desired effect or the pleasure we gain from that drugs. Let's take like antibiotics. Most people take antibiotics like ampicillin, for example, or amoxicillin that we treat for cold. Like in COVID time, because they said the symptoms of COVID are similar to that of common cold or the usual cold that we've been having. So people usually start taking different cold medicine, ginger, ampicillin, amoxicillin, erythromycin, and then just go to one facility when they prescribe it. Even if finished, by the time the person start maybe having fresh cold the next day, they just start taking it again. And they don't know if it is the same type of cold that is doing them. And as it progresses, because of they took it the first time, they feel well, they will continue to use it. And as that happens over and over without being prescribed or without taking it according to the recommended dosage, then you are abusing that substance automatically. Another way people abuse substance is cross tolerance. For instance, people who are taking, let me say, having strong body pain, they went to the facility before, they prescribe for them one analgesic, let's take for example diaclofenac or Pingo. So if the Pingo, they continue to use it over and over, even if the pain subsides or the pain go away totally, they continue to use it. They need to take more of that dosage or more of that tablet before they get that desired effect. So because of that, they will either go for more of that drugs, which is automatically substance abuse, or they go to the pharmacy and say, I'm taking the drug, but it's not helping me this time. Then maybe the dispenser say, I get another type of drugs that can do similar work. Then maybe they just take combined drugs of analgesic that can kill pain. Or they take like tramadol, they give it to them. By the time the person start taking that drug that is stronger than the previous drugs and they start to feel better, they continue to use it. That is cross tolerance, meaning you are taking one drug but you are not satisfied, you start taking another drug with the same effect and you get used to it and always you are using it. That is substance abuse right there, and it can lead to addiction. So these are some of the drugs that are abused.
Okay, thank you so much. Thank you so much for that explanation. Let's move back to Brother Kofi. Brother Kofi, today we're talking about substance abuse. Why do we worry about substance abuse? What impact does it have on our social life?
If we look at it, especially in our country, Liberia, when we talk about substance use disorder, if you just walk from here, Broad Street, you know what we are talking about. Our brothers are all on the streets because they are taking a substance. Some start with alcohol, some start with opium, and there are lists of cases that we have been seeing all around in all the community. Our brothers and sisters have been abused when it comes to substance. So the impact is actually like negative. People that we're expecting to be, in the future leaders, they are turning to be Zogo and they are retrogressing, into the society.
Definitely.
And every one of us are being affected by it. People, men, if you see some other guys and other things, are there with them. See some of them, they are drained down because of the substance that they are taking. So they having negative impact, especially when it comes to our country, Liberia, in the community and also above. Plus of manners. If we look at every one of us, we have been taped. Our relatives have been or is in or substance.
Okay, next thing, we all know that everything they say 100 miles begin with a single steps. So we all know that substance abuse is our major problem in this country. But I really want to understand how how do we start it, especially for the youth out there? What leading into it? How can they start this process?
Okay, so before we start engaging how to mitigate substance abuse problem in the country, first we should create awareness.
No, I'm not talking about stopping it. How can they develop? Why we made a child wake up today to say, oh, I want to smoke this drugs, I want to drink this alcohol, I want to. How do it begin?
Okay, this begin from different angle. One, the angle of peer pressure and social influence. So this is to say, like, one of my friend or one of that abusive friend has been using it, and then when a person uses it, they say, oh, when I use this, I feel on top of things. Maybe we go to a club, I start drinking, and then you feel motivated, or even if you are not motivated, but because if we are going to drink, we don't invite you, and you don't want to, you want to maintain that social relationship with us. You want to maintain that social class with us. So the next thing that will start coming to your mind is experiment, because substance abuse, one of the major causes is experimental uses. People want to try and see what the people really been talking about when you take this thing, how you feel. So they want to try. So by the time they try, the first time is the first step to substance abuse. That is, they just want to try. When they try, some of them, they use them over and over and say, you gotta clear the rust. So clearing the rust now means you have to take additional dose of that particular thing that you took in before. And by the time you take it, to some extent, because like for alcohol, if you take it, it will increase the activities of the brain. Within the first 5 to 10 minutes, you see the person acting, say, oh, then it's the thing I chew. It made me get all my shame. So the next minute, it starts to suppress the functions of the brain. So when that happens, the person feels depressed. So if you take it the first time, you clear the rust and you feel okay, the next time you'll be encouraged to do it. That is one of the main reasons people do it. Another one is ignorance. People don't really know that substance abuse, many different substances can be abused. Some feel only cigarette, only marijuana can be abused. But even you go into a club, you take every way you want to drink.
Good morning, your name and where are you calling from? Good morning, your name and where are you calling from? Good morning, your name and where are you calling from?
Hello?
Good morning, your name and where are you calling from?
Hello?
You are live, your name and where are you calling from? Please call back. Yeah, maybe not continue.
Okay, so like we're saying, another one could be ignorance. People, let's say you start taking, you have ulcer, and then you go somewhere, you hear people say, oh, when you get ulcer, you're supposed to take, even when the pain coming, let me say you feeling the pain, you're not supposed to take the other medicine, apart from medicine. People sometimes they drinking alcohol to ease their tension, like Mr. Coffee was saying, but they don't really know that as you are drinking that alcohol and you're getting the desire to always drink it to feel better, you are abusing that alcohol, because the percentage of alcohol within your blood level you don't know at the moment, and then you just increasing it, and that will create a lot of psychological and socio-economic factors on you negatively. Some other people, they abuse a substance because the desire they get from the previous one they use. Like we said earlier, you take diaclofenac for that strong pain in your body that have never been aware with. As you take it, the way you feel calm, the way you are able to go to bed and sleep well, the next morning you wake up stronger, you feel that using that substance again. It will be another means of getting used or getting the path of abusing that particular substance. Okay. So all of those issues contribute meaningfully to substance abuse.
Okay, Brother Kofa, what is the most abused substance out there?
Especially in Liberia, our most abused substance is alcohol. Alcohol nowadays, even small children, they are taking it in. Even the adult, if you look at the Bureau Entertainment Center, you have people every time, beer tripa, it can be empty, especially when big day coming and all of them. So most of these things then, and when we're discussing, we should really focus on and these conditions, especially the alcohol. Yes, you have marijuana, which of course, majority of our brothers and sisters are engaging in it, and it's very much bad. And these things, for sustained use, we are talking about. For sustained use, we are talking about now. We say sustained use or just use disorder. It's the same as malaria or typhoid. What happens is that, especially when you are taking in the alcohol and your brain is being depressed, what happens is it eat up the brain, especially your mental functioning, everything, it decline it. And we have the very neurotransmitters that is responsible, for us to regulate movement. So if you are taking the substance, it's not actually okay for it. It depress it and it make it for us to not have our correct thinking, the way we talk, our coordination, everything it impaired that.
Okay, so I asked Nelson a question first. Let me ask you again the same question, but I'm going to paraphrase the question. What is the root cause or the underlying factors of substance abuse in our country, specifically in Liberia?
Specifically, we have peer pressure. As he said, we talk about peer pressure is one of the underlying causes, and he said people like to, especially the young folks, they love to be along with their friends. They will say, "Oh, my man, you know what? Anything I can make you active, you can be talking like that. As soon as you just take it in, you see how you will be talking." Yeah, so they will have their drum, they will have their alcohol, that they will take it in, and somehow it will have some a stimulant effect for a while, which of course it will make you to talk. And besides that, even there are some other students sometimes when they are doing their presentation, they say, "I'm going to take my lecture." When I'm talking, I will talk with that. I can call them and say, if you go and take your lecture and you talk. So every time you want to go do your presentation, will you take lecture? I say if you continue like that, that's how addiction can occur. So see reality. Try to see how best you can manage it. And I can discuss some other techniques that that's a phobia and social phobia. Because of these things, people try to take in substance for them to be active in order for them to do that. So peer pressure is one of the causes. And two, we have other genetic factor also too can be the cause. And a case in Maryland that I saw, and when I read on that case, the father is addicted from his youth time. And what happened, he born all his children. And one thing in alcohol is that it pass through the gene. You can born your child, you can have a child, all the things. They will not just be drunk, but you know what? They already have it within them. Anytime when they are actually taking substance, they continue taking the substance, then they become addicted to it. And let me tell you, that family that from him, 2 of his children now are addicted to alcohol in the family. So some of them, one of the female, the only thing if you want to have her, just go and buy liquor for her and other things, and you will carry her. So these are things that actually can affect our brothers and sisters.
Okay, thank you so much. If you are watching on social media, on Facebook, on YouTube, please share our video. Continue to share the video. Please share our video. I want to say thank you to Stephanie. He's watching us. That's one of our incoming director or our young director from the Douglas Medical Institute. He's Stephanie. He said drugs and other substances are considered controlled substance. Under the Controlled Substance Act are divided into 5 schedules, but most clinicians are ignoring this act and serving medication, especially Schedule one drugs which have no current medical uses. So it says Schedule I control substances in this schedule have no current accepted medical use, a lack of accepted safety for use under medical supervisions, and a high potential for abuse. For example of substance listed in Schedule I: heroin, arsenic, acid. Then he got so many drugs they listed there. Oh, my network is I don't know, my phone is freezing or my network is giving hot. I don't know what happened to second network this morning. But when the other message open, I will continue to read his messages. So keep your message coming. We're going to read all your messages live this morning. Keep all your messages coming, and please do not forget to keep sharing our videos. Thank you so much, Dr. Stephanie, for adding your voice to the guest in studio. Thank you so much for that clarity and your contributions to Health Talk. So now we're going to open the phone line. The phone line is open. You can call in and share your experience, or you can ask our studio guests all of the questions you want to know about substance abuse. Now the phone line is open: 0770-107-107-0886 107-107. If you are outside Liberia and you want to be part of the discussion, you can call our WhatsApp number +231 880-571-223. That's our WhatsApp number for all of you that are in the diaspora, so you can call and share your experience with us. Now the phone line is open. We are waiting for your call. So Marvin, while waiting for callers to call on the show and share their experience or ask you guys questions, I just want you to briefly take us through some of the risk factors of substance abuse.
Okay. You see, when you start to abuse substances,
Good morning. Your name and where are you calling from?
Good morning, Mama. I'm Lawrence Stephanie, calling from my campus in Congo Town.
Oh, thank you so much, Lawrence Stephanie. Welcome to Health Talk.
Thank you so much, and thanks to the student guests. I just want to give my contribution to the program on substance abuse.
Okay.
We see substance abuse daily into our society right now, and see it in the hospital. Into our mental homes now, young people that are going into mental homes or enrolling into some rehabilitation program or are going there as a result of substance abuse.
Definitely.
And they've been reference to one of the fully synthetic opiate analgesic called Tramadol. Tramadol that is used to treat moderate to severe pain. You see, young people are going for the Tramadol on the market daily. And those people in the rural pharmacies or drugstore, even in the hospitals, they are just selling this medication to those kids out there. So it's not only the non-clinicians, you also see some health practitioners involved in transporting these controlled substances to people out there, and they are abusing it daily. Like for example, we have the codeine found within the cough syrup. Because of that euphoric attributes that people get when they take the cough syrup. You see, now people are abusing cough syrup because of the codeine. But people are not advising of the possible side effects of these medications. When it comes to various substances abuse, they get fast classification of various drugs or controlled substances. Schedule 1 for all those drugs that fall in Schedule 1, the marijuana and the other drugs, they have no medical use. That the drugs that are being abused, they're the drugs that must be controlled. But we see it into our markets, we see it into the hands of people. And I was even told by my sister that people are even smoking the same time. People are even smoking the samples.
Sure.
So that's the level
Even the
of
light bulb.
addiction. Even the light bulb. That's the level of addiction that we have in our society. So there's a collective effort that involves health practitioners. It's not only no clinicians. In the hospital, you see clinicians, you see medical doctors, you see pharmacists, you see doctor of pharmacists, you see nurses there. They are addicted to these strong drugs. They are only daily because of the addiction. They're coming for you all the time. So government or partners needs to come together and see how best we can get this out of our society or minimize the use of these substances to stop the abuse of it.
Thank you so much. Thank you so much for that brilliant contribution to the show. Thank you so much. We appreciate you a lot. So the phone line is open 0770-107-107-0886-107-107. You can call and give your contributions to the all important topic, or you can also call if you are a substance user. You can also call and tell us how you've been coping with it, which one of the substances you've been taking in, and how do you feel. What advice do you have for your peers, for your communities, for your people around you? So you can also call in and just share your experience, or if you want to know about the various substances, you can also call and ask our studio guests all of the questions you want to know about the substance. So our phone line is open 0770-107-107-0886-107-107. You can call and ask all of your questions you want to know. Please keep your Facebook messages coming because we're reading live. Let's continue.
Okay, so many risk factors are connected with substance abuses. One of them is social economic deprivement. You start to reduce your social interaction with people, will start to decline, because the first thing when you start abusing the substances and you know that other people that you have been connected with, they don't like that substance, you start to avoid them because you don't want them to take notice of it. So the first thing, the level of cooperation, the what you have been doing positively, you will be left behind. The next thing is you start to lie, because if they notice, they ask you, you either deny or you have to lie so that you can get something to go for that particular substance because of the urge. The next one is you start to steal. If you can't lie to get it, you can't work to get it, then the next one you start to steal, or you start to sell, or you start to lend some of your clothes out or your materials out or people's materials out. So that
good morning, Anime. Where are you calling from?
I'm calling from Bongkabe.
What's your name?
My name is Martin.
Marvin, welcome to Health Talk. Good morning. You are live. Oh, we lost that call. So you can still keep your call coming in. The phone line is open 0770-107-107-0886-107-107. If you are outside Liberia or you want to be part of the discussion, you can call our WhatsApp number +231-880-571-223. That's our Hot FM WhatsApp number. So you can call now and ask all of your questions you want to know about substance use and abuse.
So another risk factor could be your cognitive function decline. The way you used to think, the way you used to process information, interpret information, and be able to control your emotions, and be able to make sound decisions, and be able to guide what you are able to do. It will start to reduce. That ability will reduce because the substances you are taking are having, remember, every substance has a chemical effect on your body. So it changes the way the brain works. That is why they call it drugs.
Good morning, Anime. Where are you calling from?
My name is Brian County, calling from Single Mountain, Mountain Avenue.
Ibrahim Kanti, welcome to Health Talk.
Yeah, I just joined the program. I don't know why it's for kids.
Yeah, we're discussing substance abuse, substance use and abuse. So you got any question for our studio guests, you can ask.
Hello?
Hello, good morning.
Yeah, I'm telling you.
We're discussing substance abuse. You are live on Health Talk. We lost the call.
Okay, another negative consequences would be like for our women, we can call it a teratogenic effect. People who are abusing women of childbearing age, who may probably become pregnant in the next 2 to 3 months or years, and then they are abusing substances like alcohol. It affects the unborn child negatively, it makes the child brain to develop very poorly, especially the front part of the brain that is responsible for processing information, for making decisions, to be able to understand and interpret information, to guide the person how to write, how to speak. It declines or it makes that area to be much smaller. And when a child is born with small hair, we say in a hospital or medical area we call microcephaly. That microcephaly, some people they localize child to be Gina. But the child is not Gina, the child just resembles that habit you used to enjoy, that alcohol you used to drink, that beer and those other substances you used to abuse. That child just bring example of what you used to take in. Another one could be the child have very poor learning ability, let me say very poor learning skill. They go to school every year, they fail, or you give them instruction, they disobey. They want to take the instruction at time, but they can't remember within the next 4 to 5 minutes. So all of those things are negative effect of substance abuse. Okay. Another one could be cleft lip or cleft palate. The upper part of the mouth, which is the palate, the hard palate, is not well developed. So at the end result, when you born a child, the upper part of the mouth or the upper lip cannot close, let me say, will not properly develop, so that flesh or that skin is not tightly sealed. So there's a hole between the mouth and the nose. So when they see that kind of a child, they say like Gina or a witchcraft. It is not a witchcraft. That alcohol you used to drink is the consequences of that alcohol that cause that child to be like that. The next one is spinal bifida. The lower part of the back, from right above the waist, on the backbone, that area will not close totally because the alcohol will suppress the amount of folic acid and the amount of absorption in the mother. And as that continues, that part of the body, that lower part of the body, will not close tightly in the baby. When you born the child, that area is open, you want to run away from your own child.
Okay, thank you so much. We will come back to many of the risk factors because of time factors in studio, because only 1 hour we have. So Mr. Coffee, let me get you on board. What are some of those statistical signs, right? That you could be picking in teenage or anybody for that matter that is going through the route, so that you can give them, so that you can try to at least arrest it as soon as possible.
Thank you very much. Especially when you talk about peer pressure, most of you children want to experiment. Like yesterday, when I know a student was talking vividly, because when I presented on this case, she said her brother acted, very clever, attending one of the big schools, doing every other thing. But after his graduation, they sent him to the Bible college. But without any reason or other thing, he said he never wanted to go there. He left. Then she said again, they say, his friend found job for him to loan start sell and other thing. And when he went there, he said the people they're not correct. The people they don't know what they're doing. Other thing, he sat down. But she not believing that this boy is taking a substance. She said she can put on chopping. I said, you look at your brother. Out of everything, he was actually good in other things. But why is it that they sent him to school? He said he don't want to go to school, and they gave him work, and he just abandoned it. They asked him, he said nothing. And when they asked him, he's irritated. He won't get vexed. He just feel like he know it. And I told her, I says, please, there's the time that he need to have a clinician that will investigate and know the cause. Because when these things are happening, these are signs that are really showing that this person is taking it, but if not reached to the area which the signs and symptoms will come, he'll be depleting, but he's actually going to it. And we talk about it before she started receiving. She said she was immediately saying she can put on a letter and medicine and other things. I said, let's do what you think is required in order for us to go to medicine. So we have to talk about these are a typical sign. If you see some of these things, then the child are performing, but now they just want to be by themselves and they can get vexed. And they won't know all.
So how can we help in dealing with the issue?
Thank you very much. And in substance use, you have to that if you have a client and whatsoever, and what we should do, I mean what we can do usually is that if the patient come, we have to discuss the issue about it. Some of them based on the ignorance, they enter into it. Some of them peer pressure and other things. But let's discuss the drugs first and look at the negative effect and ask them when they take it how it can really make them to feel. It can make them want to get in trouble. It can make them want to do this other one and other thing. And one of the things in substance use, your substance users, it can help us if they are willing. If they are willing to leave it. But if we impose it on them because they are parents and other things, will not yield fruit. So we should do everything to do the counseling and the detox, and even say ask other family members that are very close to that person, to get along with the person and make the person to really come to understand that these things will damage their future.
Okay, thank you so much. So next thing, let me get it again. What can we do as healthcare professionals to at least minimize the use of substance abuse in Liberia?
Okay, I think the first thing we need to do is to create more awareness. Let the public know that anything that we take in that changes the way we feel is a substance. And if we continue to use it over and over, then it becomes an abuse. Or we take it for a longer time than the way we was to do it, then that's substance abuse. So we need to reach to stakeholders. We need to make this a public campaign, because substance abuse does not actually belong to this 21st century. So we need to work with pharmacists, as Stephanie was saying, because most of them sell those drugs. Maybe you just hear like ibuprofen, or you see like cough syrup, but you have codeine, and then you have other substances that when you take it make you dizzy, and when you make you dizzy you feel sleepy. Perhaps you are not been sleeping in the last 2 days. So if you take that drug and then you feel happy, you feel that you always go for it. So we need to talk with dispensers, people who selling the drugs in the bucket, passing around, are one of the main suppliers of those substances that are being abused.
Okay.
And then we need to talk to our children. We need to educate them about substance abuses. We also need to be very professional how people who come to us, how we treat them. Because if we as professionals, we do the wrong prescription, people will follow those with wrong prescription and start self-medicating, which is one of the main causes of substance abuse. So if we are doing those things, we'll be able to help people to minimize or to manage their substance use.
Okay, now Brother Kofi, let us just brush over the treatment aspect. What if someone is already being a substance abuser? How can you help them in time of treating them? Especially because for those of you who have experience working with people like that, how can you treat that type of people?
Well, what I did is that we have a patient that he was beaten almost to death. Actually, he was taking substance and he went to, and I don't want to just talk that other one, but when he came to the facility and the family explained everything, that he was actually taking substance. And one thing we do is that family support. I reached to the family and asked them, we want to help. Are you people willing to help also too? And everything that we do, my people, family support is needed. Especially now, we don't need hospitalization of our patient. We need de-integration. People should be to their respectful to their houses in order for them to have their patient treated.
Really? Do you really think that is necessary?
It is very
for
much.
substance abuser?
Substance, yes, I'm coming to it.
Okay.
Yeah. So for why you talk about a detox, we put him on a detox. Usually in Liberia, if whether alcohol or any other substance we use or doxycycline,
Yeah.
Yeah, we use Daxipan as a detox.
Relaxation.
We give it for 40 milligram. We give it 3 days, 2 days. We try to titrate it down until we try to do that. Then heavily we deal with counseling also too, making the person how they are feeling and how we can really work on it. And we have a plan, and you know that our psychosocial worker will do the follow up. And another thing we can do for substance user is that if they were in that community, they were doing that substance, we need to shift them around, carry them to another community, another strange area, where a family that is there will be monitoring their activities. And at the same time, these people, you don't give them money, you don't give them valuable things that tomorrow they can make it out of money to go and go get a substance. The only thing, you try to put them on regular diet, and you know, for them to eat, and you monitor their activities. It is important, but heavily it's based on counseling. Whatever we are treating you, yes, we can treat you, but if we don't treat your mind also to detox your mind, that the negative things that you are going, when we don't try to shift your mind, you definitely go back. So we heavily discuss counseling as we are doing a detox also too, in order for the person to come to reality, the recovery. And another thing we do again, we try to reintegrate them in the society. Because the way people are looking at them, especially our disadvantaged brothers, they look at them as outcasts. But when they are coming out now, there are things, some of them have skills, and the patient I'm talking about is a good carpenter. And what I did is that when we went through it, that man, he was able to wake up and start doing a carpentry.
Wow.
Now he is doing it. He's integrated in the society, and he had children. So he's managing his children. So these are things that we need to really have love for the profession and see how best we can help them. But mainly it's based on counseling and of family support.
Okay, thank you so much. Indeed, counseling and family support need to be our priority, definitely, because when somebody is going through that ride, they really need our support, our care, not stigmatization, not calling them names. So you know, time is fast spent. We can have roughly like less than 10 minutes in studio. Oh, who's calling? I think the person is going to be our last caller. Good morning, your name and where are you calling from? Good morning, your name and where are you calling from? So I have to cut you off. Please, in fact, we don't really accepting call again because we have less than 10 minutes in studio. Let me ask the both of you this question. I'm not going to answer that call, please. We are not accepting any call again because time is already fast spent in studio. So let me ask the both of you this question. Today we're talking about substance abuse. How can we prevent or minimize this substance use and abuse in Liberia?
Okay. So
just 2 minutes.
Yeah, thank God you use 2 words, prevent or minimize. Because for some people, the substance abuse is already genetic. Their parents used to use it, so it has passed through their genes, so they will get a urge to go for a particular substance. So for them, you can only minimize that. Because if you do the education one, it is genetic. If you are not around, there are tendency that they go for that substance. So one is we do education. One of the key things we also do in the mitigation or prevention of substance usage is to do education that will make them to develop the conscience that this substance I'm taking is not only making me to feel better or the way I want to be, but people are looking at me badly. Because one of the main things if you are sorting out substance use cases is you ask the person, how do you feel, or how do you think people feel about you that this substance you are using? The person, I can feel bad, and I know that people can feel bad about me, or many people have complained. So when you do the education and your conscience starts there about the substance, they themselves will confess and they will prevent, they will like to stay away from those substances.
Okay. Brother Fair, just one.
Yeah, so I feel bad if we are getting day-to-day the substance, you know, in Liberia, and our brother are really dying from it. We have to get to the root cause. We have a workshop or meeting or whatsoever in Bon County, I think a year plus. And bringing stakeholders to see how best we can control this. But now, you don't have a law on drugs here in Liberia. You don't have a law for penalty. So people that are bringing in drugs, let me tell you, if they inside hold your drugs and other things, they can keep you for a long time. They can't have it. So the government need to put their feet to fire. That these people we need to create law like or to really punish, especially the drugs dealer. Because if we don't do that, we'll just talk about it and the people are bringing it. We need to look at that law. And besides that, yes, health education is important, especially when every one of us want to do that. But if we don't get to the root cause, especially we don't have just law here. We've been talking about it. Yes, maybe there are forces there. They say we don't want to do it because they're benefiting from it. But you people are killing us, please. So from here, we are still advocating that we need to have a just law, and it will help us to regulate activities. When it comes to sustained use, it will not be a burden or national burden. It's actually a national burden because police people and even other people that get called pro, we need to get small thing to go get their desired effect.
Okay. Thank you so much, guys. It has really been a fascinating discussions. Thank you so much for taking us through and educating us about substance use and abuse. We want to take this time to say thank you to all of our callers, to all of those that send in their messages on our social media page, Facebook, YouTube. We want to say thank you for being part of the discussions. We want to take this time to say thank you to the Hot FM family for always allotting us time in studio to discuss health issues that are affecting our people in our various community. We want to say thank you again to Honorable DJ Blue for allotting us time in studio to discuss health so much.